So hello friends, once again welcome you all to Sail to MDS Dental Academy. Myself Dr. Malay Trivedi, I am pediatric dentist and assistant professor in College of Dental Sciences. So today we are here with one more YouTube premier lecture on eruption and shading of the teeth. So dear friend, before going to the lecture, just want to tell a few things regarding your preparation. Now hardly 6 months are left. You have to gear up yourself, you have to prepare properly, you have to keep on reading. Remember, to get in top 300, it is not that much easy. Okay, today I'm seeing many students all over the India calling me, sir, when revised cutoff will come. You know, aspirants, they are waiting for the third round, they are waiting for the leftover seats. So you can see how the quality of seats and how the quality of college they are going to get. So already in dentistry you have to be in the top to be away from the competition, to get through the competition. So if you go to such college, it is just for a namesake MDS. You are dragging yourself to the MDS. I want my students to be in the top 300. They should get the government college. So what will happen? When you get the government college, you will get the stipend. You will good. If you are getting good private college, you will learn the good things. After coming out, you will shine out. So 6-month work hard can change your life, can really change your life. So don't drag yourself for just that MDS word. Drag yourself for the proper things. And one more thing, aspirants, you have to understand what is NEET exam. It is not just, bulk reading, like you read for your first year, second year, third year, final year. You have to keep the balance. Now, many students are telling that, sir, for particular chapter, why you are not taking 1 hour or 2 hour class? Dear aspirants, you come to my orientation lecture, which I foundation lecture, for which I conduct for first, second, third year final student. We have a 1 hour lecture for every chapter, but you are in the NEET exam. You are going for the NEET and AIIMS exam. 21 subjects you are there. So you have to focus on what is important, how much you can able to remember what is going inside the mouth. So it is very necessary to focus on important and very repetitive things rather than going for the unknown and bulkier things. Fine friends, so please don't waste your time in reading unnecessary bulk things. But yes, use your time in reading the proper thing and also textbook reference, which is mandatory. Okay friends, so without wasting time, let's start with the today's lecture, that is eruption and shading of the teeth. So what is eruption, dear friend? It is not just the tooth within the socket is coming out of the socket in functional position. No, the eruption is a combo process of developmental as well as functional thing. What developmental means? When your tooth is developing from all those bell, bud and stages, that is a part of your tooth eruption. When the tooth is coming into functional position, when it's getting occluded, it is a part of your eruption. After that, whatever the changes occurring in your oral cavity, in your jaw, like imagine the attrition is occurring, the growth of jaw is occurring, that is a part of your eruption. So we'll see in detail in this chapter each and everything, because this chapter is so important. From last 3 years questions are asking, and recently in the NBD exam, many questions were there. So please focus it out. So friend, what is active eruption? It is the actual movement of the tooth from its developmental side to its functional position. So the time from when the tooth will move from its developmental position and coming to the occlusion, that is your active eruption. What is passive eruption? It is not a tooth movement, but it is a changes occurring in your jaw or tooth because of the attrition or some apical recession of your gingiva occur and your tooth structure is exposed more in the oral cavity. That is passive eruption. Fine. So active and passive eruption. Now we'll see what are the stages in active eruption. So it's a pre-eruptive stage. It begins from the early bell stage to the end of beginning of root formation. So please, aspirants, in the exam if they ask what is pre-eruptive phase, it is from the early bell stage till the beginning of root formation. What is pre-eruptive phase? It is also known as eruptive functional phase. What it begins? It begins from the initiation of root formation till the tooth reaches its functional position. It means what? The tooth is coming in the occlusion. That is your pre-eruptive phase. They have two phases, intraosseous and the extraosseous. Then 4 stages are involved in that: root formation, movement, penetration and the occlusal contact. So it is from the root formation till the occlusal functional position. Then what is post-eruptive or functional phase? It is the phase where the tooth will try to remain in the functional position. Okay, for example, some wear is occurring, proximal or occlusal wear, or change in the alveolar jaw is occurring, but the tooth will try to remain in its functional position. So whatever the movement occur for that, it is included in your functional post-eruptive phase. So now we'll see in detail what is happening in the pre-eruptive phase. So we told you it start during your tooth development process. So what will happen, dear aspirants? Your tooth jumps get differentiated, and when they are differentiating, enough space is there within the jaw. Okay, so where it get differentiated? Within the follicle. That's why this pre-eruptive phase is also known as follicular phase of eruption. So let's see how your primary and permanent tooth undergo this pre-eruptive phase. So what happens in the deciduous tooth? At the beginning, your deciduous tooth jumps have enough space between them. Then what will happen? Because of the rapid growth of the deciduous tooth jumps, the crowding occurs within the jaw, particularly in the incisors and canine region. So how this crowding is get related? By three things: by increasing width of the jaw, length of the jaw, and height of the jaw. Of the length of the jaw is important, which provided a room for your second deciduous molar which to drift backward and anterior teeth to drift forward. And what happens when the width of the jaw increases? Your tooth jump will move labially or buccally. And what happens when the height of jaw increases? The occlusal movement occur. Fine. So what happens, dear aspirants? The first tooth jump will differentiate, they will grow rapidly, and because of that the crowding will occur. Then it is relieved by lengthening of the jaw, which will cause the tooth, posterior tooth to move backward and anterior tooth to move forward. Okay. So you can see, dear friend, these are your deciduous tooth jump. You can see this OPG also, and you can this dried skull also. So what happens when they are growing? The crowding is occurring. So the length increases, the height increases, the width increases, and they are getting space for their own development. So this is the few points regarding your pre-eruptive phase. Then what is happened to a permanent teeth? Now there are two types of permanent teeth, with predecessors and without predecessors. So let's talk about first permanent incisor and canine tooth jump. See, aspirants, now you can see that your permanent teeth lie lingual to your deciduous teeth. So first they lie at the incisor surface in the same bony crypt. Then what will happen? The anterior deciduous teeth will grow and they will occupy the more apical position. So you can see here they were at the same level, occlusal level, and now they are occupying the apical position. So this is way how the pre-eruptive movement is taking place. Then comes the important thing, from where they are going to come out. The main thing, there is a gubernacular canal. Important question. Find the aspirants. So you can, this is the gubernacular canals. They can ask in the image based question. So when you take the dried skull of 4 to 5 years old age children, you can see such foramen. These are your gubernacular canals. They contain gubernacular cord, and this cord contains connective tissue and remnants of dental lamina. So what they will do? They act as a link between the permanent tooth germ and the oral mucous membrane. So what will happen? This is the gubernacular cord is there. How the tooth will develop, the resorption will occur, and they will come out from this cord only. So you can say this gubernacular canal provides the directional path for eruption. Fine, aspirants. So I hope you understand this gubernacular canals and gubernacular cords. So let's talk about premolars. We have talked about the incisors and canines. Then what happened in the premolars? Remember, the premolars, the story is little different. They lie first lingual to the predecessors at the level of occlusal surface. But as your deciduous molars will develop, they come beneath the divergent roots. Okay, so here what you can say, they lie at the same level, but after that development, they lie beneath the predecessors. Fine. So the same, then the same thing happens, and your gubernacular canal will open and they will able to erupt. Fine, aspirants. So please remember, they are lying beneath your predecessor, beneath your deciduous tooth. Now what happens to the permanent molars? They have no predecessors, so they will show little different movements. Remember, your maxillary molars develop in the tuberosity of the occlusal surface, and your mandibular molar develop through their occlusal surfaces. But the direction of development is little different. Your maxillary molar will develop distally and mandibular molar will develop mesially. So friend, this point is very important. So we'll talk about little space maintainers now. So where distal space maintainer we give when your deciduous second molar has been exfoliated or has been removed before the eruption of your first permanent molar, we give distal shoe space maintainer. So what the recent article says that in maxilla the distal shoe space maintainer is not required. Why? Because they are developing distally. But in mandible, if your E has been lost before the eruption of 6, the distal shoe space maintainer is required because they are developing mesially. So please remember, your maxillary molars develop distally and mandibular molars develop mesially. Then they become upright when space is available. So this is way how your pre-eruptive movements occur in the permanent molars. So basically, dear aspirants, in this pre-eruptive phase, two things occur. There is a bodily movement and eccentric movement. Bodily movement means what? Your tooth will move. So the side where it is moving, resorption will occur, and the opposite side, the bone formation will occur. And what is eccentric movement? Means what? One part will grow in compared to the other part. So aspirants, you can see here, your root is growing, but crown is not growing. Okay, and at the same time, the alveolar bone grows to compensate your increase in root length. So eccentric movement means what? The one part is growing and the other part is not growing. Okay, once again we will see here. You can see your root is growing, but crown is at the same level. It is not growing at all. And to compensate for the increase in the root length, your alveolar bone grows. That is your eccentric movement. So this bodily and eccentric movement occurs during your tooth eruption. Now we'll talk about the eruptive phase. So what is the eruptive phase, dear friend? It is from your beginning of root formation till your tooth comes in the occlusion. That is your eruptive phase. So this is important classification given by the nose and scar. Recently they have asked that what is the stage C of the nose and scar. You should remember, and it is very important image based question also. They can ask any picture and they will tell, explain what it is, then you have to explain. So in the diagram A, you can say the crown is penetrating bone and connective tissue. B, the contact of the crown with the oral epithelium. C, you can see the fusion of the epithelium. D, you can see the epithelium gets thin out. E, you can see the epithelium get rupture. F, the crown emergence, and G, occlusal contact will occur. So this is your stages of tooth eruption given by the nose and scalp. Now friends, as we told, your eruptive movement has two principal movements like the axial movement and occlusal movement. Then along with that, the other movement of the tooth also occur during the eruption. Your tooth can drift, it can tilt and tip, and it can undergo rotary movement also. Fine, so we'll see what happen in the each movement. Like in axial occlusal movement, the direction of movement is along axis of tooth. Wherever in drifting movement, it can drift in the distal, mesial, lingual or buccal direction. In tilting and tipping movement, what will happen? The movement occur in the transverse axis of tooth. Most often we can see in the permanent molars. And in rotating movement, what happen? They rotate around the longitudinal axis of the tooth. Mostly seen in case of the lower central incisors and lower canines. Remember aspirants, in this eruptive phase, three things we can see: root formation, formation of the attachment apparatus like your PDL, bone and cementum, and dento-gingival junction. So I hope my aspirants are understanding what we have studied till. So to decrease your boredom, just look at this picture. So you can see there are many, birds are there in this, and here one bird only. You will notice this first. So this is a group of the BDS and the modified MDS. And this is a group of the perfect MDS who has learned in proper college in proper manner. I want all my students to be like this. And you have to be. For that, give your extra work hard. Now friends, let's revise just once what we have seen. We have seen the pre-eruptive and the eruptive phase. So what is, dear aspirants, this pre-eruptive phase? That's your pre-oral phase. Beginning of your tooth formation till the beginning of your root formation. So intraoral phase, you can see the three things: your root get formed and the tooth erupts till the tooth coming in the functional position. So that is your eruptive phase. Fine. So now we'll talk about the post-eruptive phase. So it begins when the teeth reach the occlusion and continues for long as each tooth remains in the oral cavity. So dear friend, what are the things occurring here? The main thing occurs that the alveolar process increasing height and the root continues to grow. In other words, we can say the tooth continue to move occlusally, which accommodate the jaw and allows for root elongation. The marked changes in this post-eruptive phase we can see is your alveolar bone density increases and fibers of the PDL establish themselves. So you can say how the fibers are there in the initially. Then they are orienting themselves, and at the end you can see they orient about the gingival third, the alveolar crest and the alveolar surface around the root. And at the same time, the fibers from the delicate fibers, they become the stabilized fibers which help in different tooth movement and which secure your tooth properly. Then in this movement, post-eruptive movement, one more thing, that is sometimes the attrition of the teeth take place. So what will happen? To compensate that, the teeth erupt slightly. Okay, if the occlusal wear is excessive, cementum is deposited on the apical third of the root. It is deposited in the furcation region to compensate for the hyperfunction of teeth, and some bone opposition also occur at the alveolar crest. And along with that, sometimes the mesial drift of teeth occur. It means what? The teeth tend to move anteriorly. So aspirants, you have seen in the patients who have the generalized periodontitis or like that, they have the teeth proclined anteriorly, mostly in the adult between 15 to 16. What is that? That is a trauma from occlusion. That is a pathological migration of teeth that have occurred. So that is mesial drift only. So what will happen in that? The bone resorption occur on the mesial wall of the socket and bone opposition on the distal wall of the socket. Fine. So all this post-eruptive movement is for three main things, that is for the growing jaws, for the continued occlusal wear, and to accommodate interproximal wear. So in exam, if at all any MCQ is coming related to the growing jaw or occlusal wear or interproximal wear, it is related to your post-eruptive tooth movement. So dear friend, let us talk about theories of tooth eruption. So friend, there are 13 to 14 theories are there. We cannot say any theory is 100% perfect. Every theory has little contribution. So we'll see theory one by one and in very simpler manner. So what is root elongation theory? What they tell that as root will elongate, the teeth will push into the oral cavity. Yes, it is true. But there are few points against this theory. Like sometimes rootless teeth often erupt without the elongation of the root, and in so much teeth you can see the root formation is there but they will not erupt. Fine. Then what is a pulpal constriction theory? So this theory, what this theory says that, you know, is your pulp is soft connective tissue. As the growth of dentin will occur, the pulp will constrict, but pulp has resiliency. So what they will do, they will push something, they will give out the outward pressure, and they are saying that this outward pressure of pulpal constriction will help the tooth to move occlusally. There are a few points for the theory like that. Yes, the growth of root dentin occur and your pulp get constricted, but there are few points against this theory, like that the pulpless teeth also erupt as the normal teeth. Fine. Sometimes you have seen the premolar will erupt very fast after the premature extraction of the deciduous teeth. So this point is against the theory. Now what is the growth of periodontal tissue theory? It is of 2 points. That is a pull by surrounding connective tissue, and second is alveolar bone growth. So this theory says that the tooth will move or it will be pulled by your surrounding connective tissue, but it is completely wrong. Why? Because the PDL fibers are being pulled by the tooth, not vice versa. Okay, so the tooth will pull the fibers, not your fibers will pull the tooth. Second thing is that alveolar bone growth. So what they say is that as the growth of alveolar bone take place, it will squeeze or push your tooth out of its alveolus into the oral cavity. However, the X-ray and the histological section show that the bone does not actually touch the tooth. Really. In addition, this mechanism can operate only upon the single conical root, but not on your multi-rooted tooth like your posterior tooth. Then there is one more point, there is a pressure from the muscular action. They say that the pressure of your muscles of your cheek and lip upon the alveolar process squeeze the crown of the tooth into the oral cavity like a pumpkin seed between the fingers. But this theory fails because the tooth eruption also seen even if there is unilateral facial paralysis. Then there is a point theory known as resorption of the alveolar crest. This says that as your alveolar crest will resorb, they will expose the tooth into the oral cavity. But histological examination shows that the alveolar crest is the site of the most rapid and continuous growth of the bone. Then there is a hormonal theory by Arthur Kitt. What they say is that the hormones affect the eruption of the tooth, like your thyroid and pituitary gland. Then there is a foreign body theory. So Gottlieb has told that your tooth, your calcified tooth is like a foreign body. So the body will throw it out of the jaw into your oral cavity. So this theory is also not 100% correct. Then there is cellular proliferation theory. So this theory says that, which is given by Noyes, it told that whenever the cell gets proliferated, the osmotic pressure and the forces increases within the pulp, and this will push your tooth into the oral cavity. So now we'll talk about the vascularity theory and the blood vessel thrust theory. What they say is that the tissues which lie between the developing tooth and its bony surrounding possess a very rich vascular supply, and whatever the blood pressure exerted in this vascular tissue will act as an active mechanical factor in the eruption of the teeth. So there are few points against evidence of the theory that submerged teeth often erupt under the influence of hyperemia, and the hyperemia and periodontitis causes a super eruption of teeth. Then there is a blood vessel thrust theory which says that the eruption involves the blood supply to the tooth like vascularity theory. The blood generates the force by hydrodynamic and hydrostatic forces within the blood vessels, and they can cause eruption of the tooth. Then there is a PDL traction theory. So it has been considered that this theory has the highest validity to say that the tooth eruption occur because of the PDL tissues. So what they say is that this says that the contractile element within the PDL, the collagen constriction and the constriction due to fibroblast, are responsible for your tooth eruption. A study was done that there was a system consisting of valve, and it was lined by a perforated mesh and containing a gel plated with fibroblast, and it was seen that this fibroblast will move. So we can consider that PDL tissues, the contractile tissue of the PDL, may help in the eruption of the tooth. Then there is a dental follicle theory. So it is clear that the dental follicle is essential to achieve the bony remodeling required to accommodate the tooth movement, for it's from the tissue that the osteoblast differentiate. Then there is a bony remodeling theory. So we have seen that as the tooth move, the resorption will occur at the side where it is moving, and the deposition occur to the opposite side. So yes, this programmed bony remodeling can help in the eruption of the tooth. So friend, these are few theories regarding your eruption of the tooth. So all theory have some say, and they are involved in your eruption of the tooth. So what the rate of tooth eruption? It depends on the type of movement. There is an intraosseous phase, it is around 1 to 10 micrometer per day, and extraosseous phase, it is around 75 micrometer per day. It is very important MCQ, please aspirants note it. Then we'll talk about the shading of teeth. So friends, why the tooth has to shade? Why we mammals are given two generation of teeth? That is first generation deciduous teeth and second generation permanent dentition. So the necessity of the two dentition exists because infant jaws are small and the size and number of teeth they can support is limited. Since teeth once formed cannot increase in size, a second dentition consisting of the larger and more teeth is required for the larger jaws of the adult. So friends, now we'll talk about the events in shading. Remember, it is the elimination of your deciduous dentition. So what will happen? The reduced enamel epithelium of your successor, that is a permanent teeth, will release few inflammatory factors that will damage the cementoblast layer of primary teeth. Then what will happen? The odontoclast will come and they will arrange along the hard tissue surface, and a shield space is created which is lined by the ruffle border of the cells. And you know what this ruffle border will do? They act as a proton pump. They will keep on adding H+ ion in the extracellular region. So you know, as H+ ions will increase, the acidification will occur and your inorganic content, that is minerals, get removed. Then your organic content is removed by the lysosomal enzymes. So in this way, the organic and the inorganic content of your teeth get removed. Now what happened, dear friend? The masticative force will increase, the jaw size will increase, and that cause trauma to the PDL and degeneration of the PDL. So in this process, in this way, the shedding take place. Simple thing. First, the cementoblast get disturbed, the odontoclast will come, and what they will do, they will create the ruffled border. Then H+ ions will increase, which will cause acidification of the inorganic content, and lysozyme will cause degradation of the organic content. So you can see in this diagram, aspirants, how your bone get break down into collagen fibers and crystals, which is taken up by this vacuoles, which is also known as vacuolation process. Now how the anterior teeth get resorbed? So as we know, they are oriented lingually to the permanent teeth. So resorption occur in two ways. That is the occlusolabial direction. This is the first movement of your permanent tooth jump. Then occurs in the horizontal direction. Okay, this is the second movement of your anterior tooth. So always remember, the anterior teeth get resorbed in two manners: occlusolabial and the horizontal direction. Then how your posterior teeth get erupt? As we know, they lie beneath your deciduous tooth. So first the intraradicular bone get resolved, followed by the adjacent root, and as your alveolar process will grow, the primary molars will move occlusally, and this allow your premolar crown to be more apical. Fine, aspirants, what will happen then? The premolar continues to erupt until the premolar roots are entirely resorbed and teeth exfoliate. And the premolar then take place of the deciduous molars. So in this way, your resorption of posterior teeth take place. Then, aspirants, there is a recent concept that you all should know in the concept of shedding of primary teeth. What they told that the bone resorption and tooth resorption both are similar process, and it is modulated by a system known as RANK, that is the receptor activator of nuclear factor of kappa B. What this RANK will do, they will stimulate osteoclast formation, and in your teeth what will happen? The odontoclast will come into picture. Please, aspirants, remember this chronology of primary dentition in this classification is important, which commonly seen 4 to 6 months in utero. Then the time of emergence is important, which is between 6 months to 2.5 years. Remember, the root completion of your deciduous tooth take around 1 to 1.5 years after the eruption. Then permanent dentition, remember the classification begins at birth to 3 to 4 years, and for your third molar it go around 7 to 8 years. Then you should know when the crown get erupts, the eruption sequence is very important. Like for maxilla it is 6, 1, 2, 4, 5, 3, 7, 8. For mandible it is 6, 1, 2, 3, 4, 5, 7, 8. The root completion is very important, that takes place around 3 to 3.5 years after the tooth eruption. So please be thorough with this chronology of primary and permanent dentition. So as we have told that the bone resorption and tooth resorption are similar, so there is a similarity between your odontoclast and osteoclast. So what the similarity are there? See, odontoclast are same multinucleated cells like your osteoclast. They occupy the resorption lacunae. You have seen the ruffled border and clear zone. Then the acid phosphorus activity is more in your osteoclast as well as odontoclast, and in your osteoblast the alkaline phosphorus activity is more. Okay, these odontoclast have same origin, that is your monocytes, and here this is also promoted by rankle and inhibited by the OPG. Then there are few minor dissimilarities, like they contain fewer nuclei, the resorption lacunae are a little bit smaller, and you know what osteoclast can do? They can reduce your bone only, but odontoclast can resorb dental hard tissue like dentine, cementum, and enamel. Okay, that's why we can see near to tooth only, and also they are seen in pulp chamber and root canal of resorbing deciduous teeth. So friend, there is a difference between your odontoclast and also similarities of odontoclast and osteoclast. So friend, that was all for the today lecture. Any doubt you can ask me. From June 14 we are coming with one more batch, that is the refresher batch. Till December 20 we will complete all the subjects at least twice. First we'll go with the single subject, then we'll go for the combo subject, and at the end revision. Plus we are providing the test series subject wise, combo, unit test, and also the latest exam papers. So any more idea or any detailed thing you want, you can check out my academy or you can contact me on the number given. Fine aspirants, so please keep on working, and thank you all for the patient hearing. Any doubt regarding any subject, anything, you all are welcome to contact me.